Hello, I am Dale Eastman, a 28-year breast cancer survivor and a 2-year thriver of metastatic breast cancer. I serve as Outreach Chair for the Alamo Breast Cancer Foundation. Every year in October, the Alamo Breast Cancer Foundation partners with University Health System's Healthy You mobile mammography van to provide a breast cancer screening and awareness program. ABCF has been facilitating this outreach program for over 20 years. We hold this event to provide screening mammograms to uninsured, low-income women, as well as provide breast cancer information and women's health resources. Because of COVID-19, instead of holding a live program, we have produced a breast cancer awareness and resource film titled Healthy Women Make Healthy Communities. Featured on the film is a presentation from Marcella Mazo-Canola, MD, providing breast cancer awareness information. Retired nurse Rosemary Grabo will offer information on the breast and cervical cancer services programs. 2 patients who received treatment and surgery through the Medicaid Breast and Cervical Cancer Treatment Program will share their stories, one in Spanish and one in English. Also included in the film are presentations on Healthy Texas Women and CareLink. We welcome remarks from our honorary guests, Texas State Senator Jose Menendez and U.S. Congressman Joaquin Castro, who will provide updates on legislation that impacts the health of women and their families. I would like to thank University Health System for providing the Healthy You mobile mammography van and Valamile Social and Digital Marketing for the filming of the Healthy Women Make Healthy Communities video. Thank you to the Alamo Breast Cancer Foundation Board of Directors for their help and support. A link to the Healthy Women Make Healthy Communities can be requested at www.alamobreastcancer.org. Dr. Marcella Mazo-Canola is a physician specialist in hematology oncology. Dr. Mazo obtained her medical degree from CES University in Medellin, Colombia in 2007. She then attended the University of Texas Healthy Science Center in San Antonio, where she completed a year of research, followed by an internship and a residency in internal medicine and fellowship in hematology oncology. Dr. Mazo has a great interest in solid tumors in the Hispanic population, as well as the different health disparities that affect the San Antonio community.
Hello, my name is Marcela Mazo and I'm a hematologist-oncologist. So there are some factors that are going to increase a woman's lifetime risk of breast cancer. It's important to know that about 1 in 8 women in the U.S. will suffer from cancer in their lifetime. So the age matters. The older you are, your risk is going to be higher. Other risk factors include obesity, drinking alcohol, smoking is also an important risk factor. And also you have to take into account your family history. For example, if your mother or your sister, a first-degree relative, they suffer from breast cancer at some point in their life, your risk is going to be higher. There are some other risks that we take into account. For example, patients that have genetic mutations, those are also going to have a very high risk in their lifetime. So early detection is very important because it's going to affect your prognosis. For example, if a patient is diagnosed with breast cancer, when the tumor is very small, the chances of the patient of being cured for the disease are much higher than, for example, those patients that are going to have big lumps or, for example, spread to their lymph nodes in their armpit or spread elsewhere. So the earlier, the better. First of all, I want to say that if you feel a lump, that's not normal. You need to go and see your physician. Things that you should check and keep in mind, look at the symmetry of your breast. If you feel a solid nodule, you should get that check. If you see changes in your skin, you need to get a check. If you notice any abnormal discharge or nipple inversion that is new, you need to get that check because those could be signs of breast cancer. So what are the symptoms of breast cancer that you can see? You can feel a lump in your breast. You can feel a lump in your armpit. You can see changes in the way your skin looks. It looks like it's inflamed. You can see nipple inversion that is new. You can also see nipple discharge. If you see any of these symptoms, you need to see your doctor. So who should get a mammogram? So technically speaking, every woman over the age of 40 years old up to 75 years old needs to get a screening mammography. In some situations, your doctor might recommend that you do an enhanced form of screening with technologies like MRI, but that risk is to be determined by your doctor. Generally speaking, after age 75, we do screening mammography if we think that the patient is going to have a life expectancy more than 10 years.
Hello, I'm Rosemary Grayboe. I'm a registered nurse with the Alamo Breast Cancer Foundation. I'm here to speak with you about annual screenings. It's important that you go to your medical professional, whether it be a physician, a PA, or a nurse practitioner. It's important to have your annual screenings for diabetes, for high blood pressure, for cholesterol, and also to have a clinical breast exam. The clinical breast exam will determine what type of mammogram you will get. It is a communication to the radiologist. If the physician orders a screening mammograms, it is because there was no lumps on your breast or they didn't suspect anything suspicious, and it's 2 views. If the clinician feels something suspicious on your breast, then it is a diagnostic mammogram along with a sonogram. The reason for the diagnostic mammogram is that it is communicating to the radiologist that there's something there that is suspicious, and there will be doing more than 2 views, looking for whatever it is that the clinician felt. The sonogram will determine if that suspicious mass is a cyst, which is liquid, or if it's solid. Once you are given a mammogram, we encourage you not to get scared and do not let fear enter you. Just because there is a suspicious mass on the clinical breast exam doesn't mean that it is cancer. It could be a fibroadenoma or it could be a cyst. The same thing, if they do a screening mammogram and you need additional studies, there are some things that a clinician cannot feel. For example, microcalcifications. Microcalcifications, once they start clustering, it could be the beginning of a new cancer. And only a mammogram can pick up microcalcifications. A clinician cannot feel those at the beginning. And we encourage you to do the annual screening mammograms and the annual clinical breast exams, as we believe early detection leads to early intervention, which leads to better outcomes. Thank you.
Hi, my name is Jennifer Thomas, and I'm a 2-time breast cancer survivor. And I've got to say that when I was 40 years old, I did not know the difference between Medicare or Medicaid, but that really changed for me in my personal cancer journey. I have an interesting story. I grew up very privileged. I went to private school and I came from a line of professionals. I had a pretty exciting international career, but my desire, my dream was to be a mom and a wife. And so I waited and postponed for Mr. Perfect, and I thought I met him at 33, and I went through fertility treatments, everything like that. I lost my children, so I am childless, but I have no history of breast cancer in my family. And when I was 39, it was about the month I turned 39, I reached over to turn off a lamp, and I felt something on my breast. And this is why I'm very, very dedicated to early prevention, because had I not felt that, with mammograms not being provided until age 40, I would have been a year into this. And I actually had to fight to get a mammogram. This was in Dallas. I had good insurance, and I was diagnosed with a very fast-growing type of breast cancer. But it was all covered: chemo, radiation, surgery, reconstruction, all of that. Then I got divorced. And so I moved down to San Antonio after that divorce, and I had COBRA for insurance. I had always been very well covered for insurance. But once I moved down here, my career wasn't that great, my health wasn't that great, and I was very, very concerned when my COBRA ran out about what was I going to do with a cancer history. I was only 43, and I was living with my parents, and I was so blessed to find out about CareLink, which was community-funded insurance, and they're wonderful. But when I was 45, one night, it was a miracle again, but I felt something on myself. Again, doing my monthly checks, I felt another lump. And so I was pretty terrified because I did not have commercial insurance anymore, health insurance. So I went to CTRC for the mammogram. I was diagnosed with a recurrence, and I was told about the Medicaid program for breast and cervical cancer, and it saved my life. I was able to have wonderful care. I had a double mastectomy with concurrent reconstruction, and I was able to stay on the program for 3 years so that they didn't just rush me in to give me the treatment and then rush me out. It was a very holistic, whole health kind of program, and for it, I am just incredibly thankful. It's a program that enabled me to see regular doctors and migraine doctors, and I don't know what the components are right now, but the story is that anybody's life can take a major change. It can come out of nowhere. It can come out of two nowheres. I mean, it can change. And this program is there for people who have gone through those kinds of losses and those kinds of changes in their financial situation. And it helps them and equips them to deal with breast cancer or cervical cancer if they have a recurrence or they have a first-time diagnosis. And so I'm very thankful to Alamo Breast Cancer Foundation for pushing that through and the state of Texas for approving it. And I say, go team.
My name is Dale Eastman. I'm chair of outreach for the Alamo Breast Cancer Foundation. I am a 28-year survivor of breast cancer and a 2-year thriver of metastatic breast cancer. I am here today to present a check to Tanya Burris, who's Director of Grant Services at University Health System. We present to you today a check for 30 screening mammograms for uninsured low-income women as part of our commitment to our outreach program, Healthy Women Make Healthy Communities. We thank University Health System for their support and collaboration for many years for our outreach program, Healthy Women Make Healthy Communities. Thank you.
I'm Gilbert Martinez. I'm with the University Health, and I'm the Assistant Director for CareLink. CareLink is a financial assistance program for Bexar County residents or those that live in San Antonio. We are not an insurance, but a financial assistance program. Those eligible for CareLink are Bexar County residents that live in San Antonio and can prove that they live here. In order to qualify, there's 3 proof documents that you need to have. You need to have a valid ID. The ID needs to show your name, address, have your photo on it as well, and it has to be valid. Also, proof of income, how you support yourself. If you work, you get paid by check, we need the check stubs for the last 30 days. Your income tax, if you're self-employed. If you receive Social Security benefits, we need the current letter for the year. Also, if for some reason you get paid by cash, we do have forms that we can give to you in case you need those forms also. You need to have proof of residency, like a light bill or water bill, something showing your name and address that you live here in Bexar County and showing that you have active services in Bexar County. CareLink provides your medical services within the University Health System. CareLink is only within the University Health System, where you receive medical services. You also receive specialists if you need to see a specialist. You get prescription coverage through the university pharmacies. You get express med services, emergency room. Any type of medical services that are covered through the CareLink program are covered under your CareLink program.
My name is Tanya Burris, and I'm the Director of Grant Services with University Health System in San Antonio. Healthy Texas Women is a program dedicated to providing women's health services and family planning at no cost to women in Texas. These services they provide help women plan their families, whether they're trying to become pregnant, delay pregnancy, or avoid becoming pregnant altogether. These services really do help women with general health now and in the future. The Healthy Texas Women program is designed for women who are 18 to 44 years old. There are provisions to allow women as young as 15 to 17 to enroll in the program. They do have to have parental consent. The parent or legal guardian has to enroll and renew into the program. You have to be a U.S. citizen or a legal immigrant, a resident of Texas. You cannot be pregnant. You cannot have insurance, and you have to be at or below 200% of the federal poverty level. Healthy Texas Women provides a wide variety of services at family planning clinics across the city that include pregnancy testing, well-woman exams with pap smears, STD testing and treatment, screening for HIV, clinical breast exams, mammograms, a wide variety of birth control options like condoms, birth control pills, Depo-Provera injections, long-acting reversible contraception like LARCs, IUDs, and Nexplanons, and it goes all the way. It even provides for having your tubes tied. Another added benefit of this program is it provides services for postpartum depression screening and treatment for women who have delivered.
My name is Joellen Fraga. I work for University Health System. I'm a patient navigator with the Grant Services. Breast and Cervical Cancer Services, which is BCCS for short, it's a grant program whose goal is to help women receive quality and accessible preventative healthcare screenings at no cost. Regular screenings may find pre-cancer or cancerous condition when treatment is likely to work best. BCCS provides screening mammograms for women ages 50 to 64. It also covers breast diagnostic services for women between the ages of 18 to 64. Breast diagnostic services include breast ultrasounds and breast biopsies. Cervical diagnostic services for women between 18 and 64. Cervical diagnostic services consist of cervical biopsies, diagnostic procedures, which are tests that are performed used to rule out or confirm cancer. Women that are eligible to receive breast and cervical cancer services are women who are a Texas resident, a woman between the ages of 18 to 64, and have an income below or at the 200% federal poverty level, do not have health insurance, or are underinsured. MBCC is Medicaid for breast and cervical cancer. It's a Medicaid program that provides access to cancer treatment for qualified women diagnosed with breast and cervical cancer or certain precancerous conditions. Women are eligible to be enrolled into the Medicaid for breast and cervical cancer if they are uninsured, between the ages of 18 and 64, a U.S. citizen or qualified legal immigrant, a Texas resident, and their income level has to be at or below the 200% federal poverty level. MBCC, Medicaid for breast and cervical cancer, provides full Medicaid benefits as long as women are eligible. Women must renew their Medicaid application every 6 months. The MBCC program provides patient navigation, care coordination, and facilitates cancer treatment services at no cost.
Senator Menendez began his public service career in 1997 when he was elected to the San Antonio City Council District 6 office, representing the city's west side. He was then elected to serve as a state representative for House District 124 in 2000. Now he serves as Texas State Senator, serving District 26 since 2015. District 26 represents the west side, where the Alamo Breast Cancer Foundation office is located, in a low-income area of his district, and where we hold our annual outreach program, Healthy Women Make Healthy Communities. Each year, he supports and participates in the Alamo Breast Cancer Foundation annual outreach program. He updates the participants about the available access to care programs for uninsured and low-income women. We thank him for his continuing support of his constituents and the Healthy Women Make Healthy Communities outreach program. Welcome, Senator Menendez.
Hello, friends. Jose Menendez, State Senator, District 26, and I'm honored to be included once again at the Alamo Breast Cancer Foundation's annual outreach program, Healthy Women Make Healthy Communities. I'd like to take this opportunity to thank my friend, your Government Relations Advocacy Chair, Dale Eastman. Love the ducks on the mast, they remind me of mine. I also want to thank your Board of Directors and the Advisory Board of the Alamo Breast Cancer Foundation, and to all of those who are advocating for cancer awareness for women. Driven by your steadfast commitment to women's health and safety, you've made your mission tangible and more than just an aspirational goal. Through your unceasing work with policymakers, community partners, and health professionals, this year has been an unbelievably challenging year for everyone, as all of us have to make adjustments because of COVID-19. Stress levels are up, access to healthcare is down, and although we miss seeing our friends and family, we need to stay vigilant and take care of ourselves and all of our loved ones. And as we navigate our way through these challenging times, we also have an opportunity to address the priorities of our very diverse communities across the state of Texas. One of the issues that I will continue to advocate for is women's health and the right that women have to choices when it comes to screenings and decisions about their own bodies. This fundamental standard is the foundation of the Alamo Breast Cancer Foundations, and it's one of the many reasons why I'm so proud to support this organization. The Alamo Breast Cancer Foundation's main goal has been to end breast cancer by assisting those who have been diagnosed while working with health professionals and policymakers to spread awareness. 25 to 30 breast cancer screenings were donated this very day by the Alamo Breast Cancer Foundation, which means that 30 citizens, 30 families are going to have an opportunity to have a screening that they may not have been able to afford otherwise. Making sure women have access to these important screenings, regardless of their financial status, is the key when it comes to the ultimate goal of saving lives and saving families. Women should not feel alone or unsupported. Instead, women should feel empowered, that they have viable options. This is why I've spent 2 decades in the state legislature, and this upcoming session will certainly be one for the history books, but we're not going to lose sight of the goal. In January's upcoming session, we anticipate a historic session with the core of the state's concerns to be recovering from COVID-19. The legislature is going to need to address many issues ranging from the state's budget to the recovering economy, but importantly, and not to forget, healthcare and education, plus many more issues impacting the lives of 30+ million Texans. This pandemic has exacerbated many unresolved issues that have already plagued our state for way too long. In the midst of a global pandemic, access to medical care is more essential than ever, and we must expand Medicaid for everyone. Healthcare is a human right, and we need to ensure that all of those who are getting ill get the treatment they need without having to worry about going bankrupt or paying the rent or buying food. We're already seeing agencies asked to cut back funding in preparation. In addition to this, my office is working on legislation pertaining to COVID-19 recovery efforts for healthcare and the unemployed. We must also strengthen voters' rights, Medicaid for all, quality education for everyone, and in my opinion, access to medical cannabis. There are many budget priorities, but we must identify a more diverse set of resources to support the economy and to prevent further threats to women and children's healthcare funding. This is another reason why I plan to reintroduce my medical cannabis bill, which should allow a doctor and the patient to do the right thing for that patient. Moreover, I'm going to demand accountability and transparency in that COVID-19 funds that we have received from the federal government are put to use for the community. These public funds need to go to those most impacted, and the agencies need to follow strict procedures to ensure that contracting is done in a fair and open process. For most of us, the current situation is uncharted territory, and I think that it's crucial that we come together not only to discuss these important issues, but to stay connected with one another. One of the silver linings in all of this is that we've had an opportunity to make big and meaningful changes to improve our state. Ideas and movements that have previously progressed at a very slow pace have now been renewed with support and motivation. And I look forward to working with my constituents, my colleagues, my friends, and everyone here in the House and the Senate to get the momentum to pass critical legislation this session. In the very end, you are the experts in healthcare, and you know what's best for you with your doctors in order to succeed for yourself and your family. You may ask yourself, what can I do to help? Well, be a partner. Join us in our community effort to make it a stronger community. Get people to vote and to express their opinions on how to improve their communities. Friends, I have a very well-known phrase. Elections have consequences, and our vote can make the difference on both the local level and the state level and the national level. Please don't let others decide and determine your future. My role as a legislator is to represent my nearly 1 million constituents and to give a voice to them in the Texas Senate. But we still need you and others to stay informed in what's happening in the legislature, what's happening locally and at the federal level, and get engaged. And thanks to programs like these here at ABCF, you're helping save lives and changing families and the outcome of those in need with life-saving information. Remember to work together, raise your voices, and keep rallying for change on behalf of organizations like ABCF and all the supporting partners for the common vision of a world free of breast cancer.
Congressman Castro, at 28 years old, was elected to the Texas legislature as state representative for District 125 and served 5 years. In 2012, he was elected to the U.S. House of Representatives, representing the 20th Congressional District, which covers a huge portion of San Antonio and Bexar County. He currently serves as chair of the Texas Democratic Caucus. The Alamo Breast Cancer Foundation Board of Directors and Alamo Breast Cancer Foundation Action Network thank Congressman Castro for his leadership in ending breast cancer by co-sponsoring H.R. 2178, the Metastatic Breast Cancer Access to Care Act, as well as signing the Dear Colleague letter supporting the $150 million appropriation to the Department of Defense Breast Cancer Research Program.
Hello y'all, I'm Joaquin Castro and I represent San Antonio in the U.S. House of Representatives. I want to thank Dale Eastman and the Alamo Breast Cancer Foundation for including me in this year's Healthy Women Make Healthy Communities outreach program. Despite considerable progress in prevention, more accurate diagnosis and better treatments, about 12% of American women will develop breast cancer in their lifetimes. And breast cancer remains the second most common cancer in American women. We must continue to invest in breast cancer research, which is why I joined a bipartisan group of members earlier this year in requesting that the Department of Defense peer-reviewed breast cancer research program receive $150 million in next year's budget. This world-class research program has greatly contributed to our understanding and treatment of breast cancer for nearly 30 years. I'm also a proud co-sponsor of H.R. 2178, the Metastatic Breast Cancer Access to Care Act, which would waive certain Medicare and disability insurance waiting periods to guarantee folks suffering from metastatic breast cancer that they're able to access and afford the medical care they need. Again, thank you to the Alamo Breast Cancer Foundation for stepping up and leading in our community and making sure that all women, regardless of income and insurance status, have access to the care they need. Thanks for having me, and I look forward to seeing you all soon.